Hello, I'm Dr. James Bogash, Master of Health and Longevity and creator of Modern Health Myths. And today we're going to talk about what it means if your blood pressure is bouncing around throughout the day. Uh, so basically we could break blood pressure into a couple different categories. There's normal, which is what we'd shoot for. There are people that have high blood pressure, which is not what we want. And then there are people that bounce around. So most people have probably heard of the concept of white coat hypertension, meaning that when you're at the doctor's office, your blood pressure is higher than it should be, but all the rest of the time it's low. We used to kind of brush that off, but we now know that that white coat hypertension is actually associated with problems, heart disease and stroke problems, even though most people think that it's okay because your blood pressure is normal outside of the doctor's office, but that bouncing around suggests that there's a problem controlling your blood pressure. Well, what about the opposite? What about when your blood pressure is normal at the doctor's, but then it starts going higher at other times during the day? Well, turns out that's actually a pretty big problem. And really boils down to the fact that checking our blood pressure throughout the day can really give us some insight or clues into what our risk may be. I remember a patient, older patient of mine, and we identified her as having high blood pressure. We sent her to a primary care doctor who put her on medication. Not the preferred, but her blood pressure was pretty high. We're talking 180, 190, 200. Can't remember exactly, but it was a scary number, especially in somebody who was in their 80s. Well, the doctor gave her blood pressure medication to take in the morning, and he thought everything was fine. And then she'd come into my office in the afternoon, and her blood pressure was starting to climb again. It was in the 180, 190 range, which is back into concerns over stroke. So I had to call the primary care doctor's office twice to wake him up to the problem that he wasn't managing this patient, and had she had a stroke, he would have been completely liable and completely unaware that this was going on, despite the fact that I tried to let him know that there was a problem and he needed to address it. So this idea that blood pressure can bounce around throughout the day sometimes happens with medications, but it can also happen without medication, that your blood pressure may bounce around throughout the day. So what happens if it's normal at the doctor's, but by the evening it starts to creep up? Well, turns out that's a pretty big problem. This particular research study looked at almost 6,400, so 6,359 patients whose blood pressure measured it's called ambulatory blood pressure. So they're sent home with a monitor and they're checked throughout the day. And they followed for an average of 4.5 years. So plenty of time to see what might happen with these people. Nobody at the beginning of the study had heart disease. Turns out that those people whose blood pressure was higher at night they were 18% higher risk of having heart disease for every 20-point elevation at night. So if your blood pressure went up 40 points at night, that was a 36% higher risk of heart disease, and a 25% risk of heart failure. So not just having heart disease, but actually having heart failure. That would then be a 50% increased risk if your blood pressure went up 40% or 40 points. So those are some scary numbers. Then, for the people whose blood pressure was normal during the day and then started to jump up just at night, the risks were even greater. So they found that those patients, 48% higher risk of heart disease and a 245% higher risk of heart failure. So those are some pretty serious numbers and risk. But it boils down to the fact that blood pressure is about controlling and keeping your blood vessels healthy throughout the day, throughout throughout, by the hour, by the day, by the week, by the month, by the year. It's not about checking it 1 time or 2 times or 3 times and taking a medication and thinking we're okay. It's about making the right choices that are good for your blood vessels so that they treat you well throughout the day and that your blood pressure remains stable. So as always, I'll post a link to this particular study in the comment section. Make sure you share this video with somebody who you think has high blood pressure and needs to better manage it. And like the video and subscribe to the channel.